And I'm going to get some pillows. I like to use pillows. Some people like to use bolsters. This is the best way I've found. Nice, big, fat, fluffy pillows. So I'm taking the bottom sheet along with everything else. I'm folding it over Leah. I've got a fairly flat pillow on the bottom that I'm using here, and a big, fat, fluffy one on the top. Let's see, there we go. Now I'm going to bring everything back over. Okay. So now, Leah, I'm going to have you hop on your left leg and bring your right leg over the pillows. There you go. Okay. And for her comfort, I'm going to give her a pillow. There you go. Now I'm going to work the IT band. Okay. So again, I want to make sure that you're lunging, legs straight, back straight, and your neck is straight. You're not tilting to one side or the other. The body mechanics are extremely important with this because you're going to wear yourself out if you don't have the proper body mechanics. This is a very grueling massage to give, and it can be to receive as well if the client's in a lot of pain. All right, so I've just oiled up her leg. I'm oiling up my forearm. I like to use canola oil for this because it allows me to use the correct speed. It's got the perfect viscosity for this type of work. Lotions absolutely don't work, so you can try it, but most people give up on that one. So I'm starting right at the bone. I'm kind of just starting on top of it and sliding off. I don't put any pressure on the bone, that would hurt. I'm just using it to find the insertion point. With a floppy wrist, you don't want to do this. Everybody wants to do that, including myself, and you might catch me doing that today. But the intention is to have your wrist be nice and floppy. I'm going to go pretty deep and really slow. So this is going to take a little while. You want to push into it until you feel it pushing back at you. This isn't a contest between you and the muscle, so I don't want you feeling like you should just push as hard as you possibly can. Just go until you feel a little bit of a ridge pushing back. And then the speed should be only fast enough for that ridge to be letting go and letting you in. I'm not using my elbow at all. It's just the forearm. I also like to do it at a little bit of an angle, right about here, because sometimes people will have an adhesion that comes down diagonally like this. If you go up the IT band at a diagonal, you'll go over that adhesion nicely without popping over it, which is really painful for the client. If you feel that the resistance is just not letting you move, you're on that adhesion. So what I do is I'll let off a little bit, and then you'll find that you'll just roll right over it, and then you can apply the pressure again. She, so far, does not have that adhesion, so that's good. Usually you find that adhesion for people with some pretty bad back problems. And Leah's fairly healthy, so she doesn't have a lot of pain going on. Okay, it tends to get more tender the higher up towards the bone you go. I want you to make sure that your elbow is under your shoulder as much as you can. So I'm bringing my body up with me. I'm not allowing my arm to go up. I'm bringing my whole torso up too. which means if you have to get on your tippy toes, that's what you got to do. So make this a complete stroke. I want all the way up to the bone, but ease up the pressure a little bit as you're getting on top of the bone. Okay, and I'm going all the way over it. And that's where I'm letting go with my pressure. And you'll see the ischemia right here. It's turning pink. This is where her issues are. Sometimes the pink will be down here. It's just wherever it was the tightest, the blood is rushing to that area to fix it. So you know that you did a good job if you see pink.